Welcome back. Investing in the future of women in our community. Here to talk about a growing partnership is Vicki Eaton-Johnson. She's the Executive Vice President and Chief Community Officer of the Cleveland Clinic. And we have Jason Joyce joining us, the CEO of Hitchcock Center for Women, which is really a neighbor to the clinic, right?
Yes.
It's nice to have you both here. Thank you for being here this morning. And you have a wonderful partnership. And I know that you are probably so excited about the clinic.
Ecstatic, yes.
Right?
That's been great.
Can we, first of all, the clinic itself, what all do we offer at the clinic?
So we are an addiction treatment provider for women. Our two primary services are residential treatment, so that's that intensive service, usually about 30 to 45 days, where the ladies stay on our campus, and then also recovery housing. But what we do that's most unique is we allow the mothers to bring their children with them while they're on our campus in treatment.
And I was reading some statistics that were very jarring.
Yeah.
More than 15 million women in the U.S. have used illicit drugs in the year of 2022.
Yes.
And when you looked at this number, the pregnant women with opioid use disorder at labor and delivery more than quadrupled from 99 to 2014. So this is clearly an epidemic that we need to deal with.
Huge. I mean, just in Cuyahoga County, there was almost 700 overdose deaths last year. So, I mean, just an unimaginable amount of pain.
Do you find that sometimes people just, either they don't realize they have a severe addiction to something and or they don't know how to get the help that they need?
Both. And I think the stigma sort of helps or hurts too, so that, you know, people don't want to come into treatment because they feel like maybe it's a moral failing or people have judged them previously. But we really view addiction as a disease. You know, you treat it like you would diabetes, and that, you know, we have to provide a level of care so that the ladies can get the help they need.
And real quick to point on that, if someone is nervous about the stigma that comes along with it, if someone's pregnant and they find that themselves in that position, they won't face any legal action if they're
no legal action,
correct?
no. And technically, as far as therapists go, we're not required to report anything. So it is a very safe, confidential environment where they can feel comfortable.
And Vicki, again, let's get into the Cleveland Clinic's role in all of this and why they felt the necessity to be a part of it.
So for all the reasons you just cited, we have three public health priorities, excuse me. One is infant and maternal health. So to have a neighbor like the Hitchcock Center for Women just right there that we can support just makes all the sense in the world. To your point, women are reporting to labor and delivery with opiate addiction. If we can address that issue, that reduces the chance of the baby being born unhealthy, unwell. So babies are at risk, moms are at risk, and to have someone as close as the Hitchcock Center, our next door neighbor there, it just makes so much sense for us to support them.
So this expansion that's taking place, there's big expansion happening,
Huge,
right?
yes.
What's that? What all will that entail?
So we're doubling our residential treatment size. It's going to be in the same location, so right next door to our current building, so we're expanding our campus. And then we're also expanding with housing. So we're having housing on our campus. So, you know, because a lot of times when people leave treatment, maybe they don't have safe housing or the environment that they're going back into is difficult. So we're having housing on our campus too. So super excited about it.
And how does that work? And if someone needs to stay there for housing purposes, is it just if you feel that the need is there for them, they just stay?
We have two main funders, so our local Cuyahoga Adams Board, and then also Section 8 vouchers.
And I have to just, when I look at these figures, $2.5 million Cleveland Clinic is putting towards this.
Absolutely. So, and here's the interesting thing. They did not call us. Because we are rooted in the community, I live a few blocks from the project. We knew what was happening and we said, how can we help? Again, we can't address social needs alone that impact health. We have to do it in partnership and collaboration. So we were very happy that they accepted our gift and that we can make this happen.
It's amazing, and it's getting to the point of getting to the root cause of something before it's too late, possibly for a child or for a mother, and it's so important. And again, so if there is someone out there watching who is struggling themselves, what would you say to them?
I'd say certainly contact Hitchcock Center for Women. So www.hcfw.org is the best way to do it. But also just feel comfortable, right? And if you have a loved one, be kind to them, right? If they're struggling, be kind, come to it with a place of understanding and respect, and then hopefully we can kind of move them along to accept that they have this issue and we can work with them.
It's beautiful, it really is what you guys are doing. Wonderful partnership happening there too. Thank you both so much for joining us this morning and shedding some light on that.